It's pain directly located over the greater trochanter, so there'll be directly pain on palpation with this diffuse referral into the lateral thigh, which can go down into the proximal part of the lower leg. It's often worse with loading, especially walking upstairs, standing on one leg, walking up hills, and then running, putting more tensile load through that region. Often pain with sitting and laying on the side, so that adds extra compression to the structures on that lateral hip. Now, as it's developed over the years, it was traditionally referred to as greater trochanteric bursitis. Now, the treatment involved rest, ice, and stretching. So the problem with rest, ice, and stretching is that it really directs that passive approach. Now, as our understanding has developed and grown over the years as the primary mechanism or the primary pathology behind lateral hip pain, it's probably not best directed to rest, ice, and stretch it. So what's in a name? A syndrome is a cluster of symptoms, and the term syndrome may have negative effects on a patient's thoughts, beliefs, and engagement with treatment. Okay, so it's very uncertain as to what is a syndrome, what does that mean? No one really knows, my clinician doesn't know. So that can really lead into uncertainty from a patient's cognitive processing. So leaves that uncertainty, and a lack of accurate diagnosis can really delay that recovery. If we're delaying someone's recovery, that can affect their quality of life and their earning potential, and we've got this chronic pain cycle where people tend to rest and be fearful of making it worse. I don't want to exercise because if I've got a tear or I've got a syndrome or I've got an itis, that's going to make it worse. Okay, so that's where it's really important to give our patient a bit more understanding of what that condition actually is and how to direct our management towards that. So let's look at the trochanteric bursa. Again, this is with GTPS, people often say, well, it's bursitis. All have those clients that come in saying, oh, it's my bursitis, I've had it for years. Well, let's look at the bursa and its job. So its job is to absorb and disperse load over a greater area at the enthesis. So it should be absorbing that compression. It should be absorbing that tensile load to take some pressure off the enthesis. So bursitis usually occurs at the subgluteus maximus bursa, but also happens at the subgluteus medius and minimus bursa as well. So you can see here, let's see if this clicker will work. No, send over here. Okay, so we've got the trochanteric bursa, and then a little bit more proximal we've got that subgluteus medius bursa, and then slightly more anterior to that is the subgluteus minimus bursa. Oh, that's okay. We'll get to that later. Thanks. Now, over here, you can see sort of the diagram of where those bursa will sit in relation to that greater trochanter. So it's important to consider this when we look at palpation and where the source of nociception. So this article was a sonography of greater trochanteric pain syndrome and the rarity of primary bursitis. So of the 877 patients with greater trochanteric pain, 700 of them did not have bursitis on ultrasound. So 80%, that's a pretty significant amount that aren't presenting with bursitis on ultrasound. So bursal thickening is often a normal adaptive response to loading. Okay? As its job suggests, it absorbs and transmits load over a greater area on the greater trochanter. So that thickening is an adaptive response to loading. Fluid in the greater trochanteric bursa is secondary to gluteal abnormality. So that's important because we're directing our treatment at the bursitis that's secondary to the tendon-related problem. You can see how that could really delay a patient's recovery. So we really need to be aware of these diagnostic labels in the way that we direct our management. This article was a sonographic evaluation of gluteus medius and minimus tendinopathy, and tendinopathy and partial tears were common in the deep and anterior portions of the gluteus medius tendon attachment. So the tears and the changes to the tendon often happen where that tendon's attaching to the bone. And of 8 of the 75 hips had fluid pooling in the greater trochanteric bursa. So not that many. If we're thinking when someone comes in with lateral hip pain, it's important just to have that understanding that, I mean, there may be some bursal irritation, but if we direct that treatment towards the ice, rest, stretching, when the underlying pathology is more than likely going to have some tendon involvement, and tendons respond best to load management, that can really help us understand how we can get better results faster. So, time to question gluteal bursitis. It may play a role in nociception, but it's often secondary to gluteal tendinopathy. Okay, so there's been many studies looking at increased amounts of substance P within the bursa, but it's often secondary to a gluteal tendinopathy. So it may direct a passive approach and more potential for mismanagement. Therefore, the treatment should be directed towards the treatment of tendinopathy. So gluteal tendinopathy is the most prevalent lower limb tendinopathy. It's usually in the anterior and deep undersurface fibers of that tendon. So right where that tendon attaches to the bone at that enthesis, there's more compressive load on those gluteal tendons, which leave it more vulnerable to failure. So it can be a result of underload or overload, which is quite interesting when you think of a lot of those patients that present with lateral hip pain. They're not usually the most athletic, high-level athletes. You'll often see it in a lot of your sedentary population that sit for a long period of time.